Hi, good afternoon, everybody, and thank you for joining us today for our webinar on 2 years of the Digitising Social Care Programme. We'll get started in just a moment, but give people time to join. It's only just 2 o'clock. We'll just let you know that you are in the right place, and we'll be starting probably about 2 to 3 minutes. Right, it looks like we sort of stabilised in terms of numbers of attendees, and we will be sharing a recording of this session if more people join. So once again, thank you very much for joining us this afternoon for our webinar on 2 years of the Digitising Social Care Programme. We're really grateful to NHS Transformation Directorate's Digitising Social Care team for making time to be here today and to talk to us a little bit about sort of how digitisation in social care has been happening. Some housekeeping just before we start. This webinar is being recorded and we will share the recording and slides with you later on this afternoon once we've finished. All attendees are on mute and we can't see you, I'm afraid. So if you do need to get in touch with us at all, please use the Q&A function at the bottom of your screens to ask any questions. And we have loads of time for questions at the end. And use the chat to introduce yourselves, to say hi, to have conversations. And also if you have any technical issues at all, please pop those into the chat and we will try and help you out throughout this. And on the next slide, we'll just briefly touch on the agenda. We're going to hear from Alice Ainsworth, who's the SRO for the Digitising Social Care Programme, sort of do a bit of an overview and intro. Then her colleague Louise is going to talk about the benefits that we've been seeing around the adoption of digital social care records nationally. And then we're really, really lucky to have been joined by Nottinghamshire ICB to talk about what's happening in Nottinghamshire, and Andy Griffin from Helping at Home. He's going to talk from a home care experience. And then also from Shropshire, Telford and Wrekin, ICS, about their digital transformation programme. And Debbie Price from Coverage Care is going to be talking about it from a care home perspective. So, as we're just getting started, to let anybody know, just in case you don't know who we are at Digital Care Hub, sorry, my name is Katie Thorne, I'm project lead. We're a partnership project run by members of the Care Provider Alliance, the National Trade Associations, and we're funded by the Department of Health and Social Care and NHS England to provide support and guidance to care providers around technology. And so we're bringing this series to you today to talk a little bit more about digitisation in the sector. So that's enough from me, I think. So Alice, if I could pass over to you, it'd be great to hear from you.
Thanks, Katie. So 2 years into the programme, I thought I'd just provide a little bit of context on where the programme came from, a little bit on where we are now and where we'll be going. So I've been with the Digitising Social Care Programme since it started, as has some of the team. We've grown quite a lot over these 2 years and brought some great people into the programme and some great people out in the system who are helping all the providers to digitise. So the programme came off the back of some of the work that we did in response to COVID, where we really sort of ramped up the support and engagement with the care sector, and particularly looked at how we could utilise some of the digital tools that were available, and it helped us see what some of the gaps were. And we worked very closely with the Department of Health and Social Care and other parts of government to put forward an ambitious funding proposal that was first announced in the Social Care White Paper in 2021. So that was the People at the Heart of Care white paper. It talked about all of the government's ambitions for transformation and reform in social care, and that included some of our ambitions around digitising, particularly around digital social care records. So why did we focus on digital social care records? We see them as the backbone, as the sort of the foundation for data sharing, and as part of that, as delivering really strong person-centered care. Louise is going to talk a little bit next about some of the other benefits of digital social care records, but it's that delivering person-centered care and that high quality care, which is why the Care Quality Commission have said that they see it as increasingly difficult to obtain a good or outstanding rating without quality digital social care record. So it's really backed up by not just the department and NHS England, but also from the regulator as well. So we're 2 years in. It's a great time to say thank you to everybody for all the work that's gone on so far, and really mark the great progress that's been going on up and down the country. We have now got more than 60% of providers that have adopted a digital social care record, and some recent data that we got back through the capacity tracker has showed us that we've got thousands more in the process of either buying a care record or implementing. So we're making really good progress towards our targets. We're hearing some great stuff around the benefits, and every time I go out to on visits, I hear different stories, different examples of how care records or digitisation have been supporting providers. So I think you'll really enjoy Louise's section next. And then just to finish, so we're 2 years in, we've got 1 more year left of this programme, and I'm really pleased that we've been able to extend funding into the next financial year. So we're going to be continuing to provide funding out to ICBs to support providers to take up digital social care records. Like I said, we're 2 years into a 3-year programme, so if you're thinking about it, make sure you take advantage of the funding and the support while it is available. Because there's a great support offer out there at the moment, and I wouldn't want you to miss out. Thank you.
Thanks, Alice. That was really helpful. And I've just popped into the chat as well a link to where you can find more information about funding if anybody doesn't have access to that, and it will be in the slides as well. So great, before we go into Louise's section, we have an amazing animation which has been created recently, which talks about the benefits of digital social care records. So hopefully we're going to get that up to be able to play for you.
As a care worker, I work hands-on with such a diverse range of people. One day, I might be supporting someone's personal care or helping with their medication. The next, I could be preparing a meal or providing emotional support. Going digital means we can add notes and upload photos as we go along, putting people back at the heart of care. It's not just us. This can save activity coordinators around 1.5 hours a day too.
As the team leader, digital technology saves me at least 20 minutes a day not having to write up handover notes. As for initial care assessments, they used to take 1 week. Now, 2 days.
This makes my job as a registered manager much more straightforward. It's easy to stay on top of the CQC compliance and maintain a great rating in the assessment framework. We've even reduced care plan audits from 4 hours to just 30 minutes.
This time saving and efficiency helps every level of the organisation.
Meaning more of this.
Visit our website to find out more.
Great. And over to Louise then. And just to mention, sorry, before Louise starts, Alice has to drop off fairly soon, but if there are any questions you have specifically for her, Karen Bustle from the team will be around later to answer questions, and we can always take them away, I'm sure. So Louise, over to you.
Thank you. Hi, everyone. As Casey said, and Alice, I'm Louise Pearson. I'm the benefits lead for the Digitising Social Care Programme, or DISC, as we refer to it. I'm really sorry if I use acronyms. I'm going to try really, really hard not to. So just a little bit about how we came up with the benefits from that video. We wanted to create the animation for the benefits to be a bit more digestible. And let's be honest, something like that is always much more interesting to look at rather than just a couple of slides on a screen. So this is my whole job. So I've been doing the benefits for this program for the last, it's coming up 2 years, it'll be 2 years for me in May. And we have had to change our approach. It has had to be a sort of flexible approach as we've understood how the ICBs work best, where our data is coming from, the quality of the information we're getting, and what we need at the centre, really. So a little bit about our approach at a central level. So as Alice said, we work with all 42 of the ICBs across the country. I'm engaging with all of those. They are required to return quarterly reports. I'm sure if you ask them, that's their favourite time of year. They love those. But within those quarterly reports is a benefit section. So they're required to return on 2 different benefits that we at the centre have identified, which span across medication errors, hospital admissions, down to time savings, and also family satisfaction, morale, that sort of thing. So each ICB gets to choose 2 from that list. All of that will continue to be returned on until the closure of the programme, which Alice said is coming soon, so bear that in mind. But what we actually also did was we've created a new central fund for larger providers, and I've kind of piggybacked onto that. So you hear a lot about time savings, and I am going to talk a lot about time savings, but I'm going to mention other benefits we've seen as well, don't worry. But you know, we think the time savings are where you're going to see the most benefits, but of course they're the most difficult to measure as well. And so what we found was a lot of ICBs were struggling they didn't have the resources to go in and do that detailed work. And I'm a nerd and I wanted to do it myself. So Alice and Peter, our program director, said, absolutely go out and do that. So for the last 6 months, myself and a business analyst have travelled across the country. If you go to the next slide, please, you will see a lovely map. These are our sites that we've been to across the country over the last 6 months. So we've been to between 22 and 25, we've engaged with multiple sites, and those were from 8 large providers who volunteered and wanted to work with us on this intensive study. That intensive study, like I say, has involved myself and the business analyst traveling to these locations. We are spending about 6 or 7 hours at each site. We are engaging with staff, whether that's care workers, managers, activity coordinators, RGNs, and everybody that works within the sector at mainly care homes, but we have also engaged with extra care, supported living and dom care providers as well. We are shadowing processes as they happen, and we're then mapping those processes out so that we can see how long things are taking and where that time is going when we are making things, you know, a little bit quicker through the use of a digital record. So just at this point, I want to say, like I say, this is not just about time savings. We have found lots of other benefits, but the first couple of things I'm going to focus on are the time. If you go to the next slide, please. The slides are busy, and I know that you don't have to read everything, but just so you know the setup, we've picked out a couple of key processes that it shouldn't matter what type of care setting you're in, you will do these processes. So you will be saving time, and you've got a pre-implementation time, which is as it was when it was paper, and then you've got a post-implementation time. Now, what I will say is all of these numbers have been validated across our 25 sites. Now, obviously, I'm not saying that means that's an exact average that's going to be calculated across the thousands of sites out there, but it has been validated across all of the sites that we've been to. And what I also want to say is this time has been saved within weeks of the digital social caring being in place. So we've been to sites who have been live for 2 weeks and they've seen these savings, and we've been to sites that have been live for 6 months, a year further down the line, and they're seeing the same savings. So that's something also to bear in mind in terms of your time frame. So initial care plans, they were taking, you're meant to have your sort of initial care plan within the 7 days of admission. Now, what we found was actually they could take much longer than that, sort of 2 weeks before a registered manager was happy to sign those care plans off. So they were having to complete multiple 72-hour audits. And whether that's because they weren't happy with the quality of information that was in those care plans, or whether they were missing assessments or documents. And actually what we've been told now, and what we've seen, is that care plans are being signed off within that first 72-hour audit. So all of the information is there. They are happy with the quality. So actually, you're reducing that risk from the additional time that would have been taken to do those audits. So that's a massive positive for us. Another one, care plan reviews, 10% occupancy a month. Some providers absolutely are getting that done on time, but we have heard that there are lots of people who are struggling to do that occupancy within a month, that they were taking 4 hours. And when we say they're taking 4 hours, that's if you're left in a room to do that care plan review from start to finish. Let's be honest, that never happens. You might start it one day and finish it next after you've been called away to do something else. And what we've found now is that actually they're taking 30 minutes to do from start to finish, 45 minutes if changes need to be made. But actually, because care plans are being updated much more regularly, there actually weren't lots of changes that had to be made on a review, because they'd been done sort of ad hoc as and when needed. So what we've found is that 10% occupancy is being done a week. So again, CQC wise, you've got a really good argument for saying how much more regularly you are auditing your care plans, how much more up to date the information is, the quality of that data. And of course, you can show that by pulling a report from your digital social care record. You don't have to do an audit to say how many times you've reviewed that care plan. So all of that's been really positive for us to see. If you could go to the next slide for me, please. Some other things we've looked at are some financial savings. Now, I'm sure it's been said many, many times, but I'm going to say it again. None of this work was ever to say that we're saving you loads of time so we can save that FTE because you don't need them. It's never been about saving loads of money. That was never the point of this work, but it is a box that we have to tick at the center, and it is something that actually we can see that everybody that puts in a digital social care record is going to benefit from these financial savings. So on average, we've seen from 10 boxes a month of paper being ordered down to 1. And really, okay, that's not a massive amount of actual money, but really it's just one job off the list. And that was something that we were told was anything is better than what we were doing previously. Now, this is something, again, you might not see this amount of saving because we were talking to large providers with hundreds of locations, but you will see financial savings from archive storage reduction. And also we've heard people had to decommission rooms in homes to use as storage rooms, and actually that's not happening now, so they're able to up their occupancy from reducing their storage. So that's other things we've seen as benefits there. Next slide, please. So then something I wanted to highlight was some benefits from tasks that no longer need to happen at all. So we've talked a lot about, we're saving time from making a process quicker or making it easier to do. These are things that now don't need to happen at all. So a lot of things we've seen are the handover document. There's no need to sort of prep for handover anymore. When you do the update, your daily interaction, you have a little button that says add to handover note. So that immediately is saving RGNs or team leaders or whoever is writing that handover document at the end of the shift, at saving them about 30 minutes on average from having to write that up at the end of a shift. The same for the supplementary notes. It's not needing to happen because all of that information is already there on the device. Now, obviously, you are going to have to write up daily notes. That is still going to have to happen. But what we have heard is the part of the process where all of your staff are sitting at the end of a shift. You know, the number of times we heard that people were sitting at the end of a shift for an hour or 2 hours writing up everything, that just isn't happening at all now. People are making the updates as they go along, whether that's texting, you know, and updating straight away, or whether that's using the dictation, the voice to text functionality. They're doing that as and when as they go along. So actually that sort of end of shift time is not being used in the same way. And something else was, you know, these ad hoc tasks, which, yes, you might only do them a couple of times a year, but actually we know how time consuming they are. Those sort of external queries, you know, social worker annual reviews, local authority wanting to know about funding, those sorts of things. All of that prep time is just reduced drastically. So, you know, if somebody wants to see the daily notes from the last 3 weeks, you don't have to trawl through all of that paperwork. You can literally just click the 2 dates, download all of that information and email it off. You know, that's a 10-minute job now that previously would have taken someone a couple of hours. So actually we've seen that massively. And again, of course, it's just peace of mind. You know, people are not worried about, oh God, I'm not sure that information is going to be there or what it's going to look like, or if I'm going to drop the folder when I'm looking for something and then it's going to take me hours to put it back together. You just don't have those sorts of worries to deal with. Next slide, please. Now, I'm sure you're all sick of hearing me talk. So I wanted to have some quotes on here from the people that, you know, actually really matter. There's me doing all of the visits, but actually it's about what people using it have said. So the point of all of this was to save time so that people can go back to spending more time with those they're supporting. And I'm really happy to say that we've absolutely seen that that's what's happening. So again, this of course is really difficult to measure, and my job of course is data, if I can get data. So, you know, I haven't got a way of showing that in data, but this is the only way to show it. So what we've seen is lots more activities. So lots more formal activities are happening, mainly on weekends when activity coordinators might not be working on shift. We've heard that many more one-to-ones are happening, you know, kind of up to 1 a day, many more a week though, definitely. And that activity is not happening just with an activity coordinators. The care workers are finding that they have time to do that. You know, the same thing about benefits around the data analysis and the trend analysis that these systems do. We've heard quite a bit about weight management specifically. So, you know, on a dashboard, when you're looking at all of the people you're supporting, your residents, your clients, I know everyone uses different wording around that. So when you're looking at your dashboard, if the system picks up that somebody is consistently losing weight, they highlight that person in red, and it allows a manager or, you know, that key worker to see that something needs to be done there. So what we've seen is actually that people are being much more proactive. They're working, which allows them to prevent the severity of some issues, to contact GPs quicker. We have seen in the homes that we were engaging with, actually they have reduced hospital admissions and ambulance conveyances because they are able to deal with queries quicker and they are identifying issues quicker. We've also heard that, you know, actually it's enabled managers to what's the word I want, sort of tailor the training that they're asking their staff to go on. If they've noticed sort of trends in incidents or how things are being dealt with, they're then tailoring those training courses that people are being sent on, all of which I'm sure everyone would still do, but it would obviously take you much longer to do that if you had the time to do that at all. And of course, how many people have we heard say, I never get to go to the loo, I never get to have my lunch, I never get to leave my desk to do anything. That's absolutely not happening anymore. People are still working overtime, of course, that's not, you know, but actually it's by choice. It's if something's going off that they can't leave. They're not just working hours and hours and hours at the end of the day just to do their paperwork or just to do their audits. And that's really great for us to see. Next slide, please. Now, Alice mentioned it, and I'm going to reiterate it. CQC are on board. We are engaging with CQC. I've got the exact quote that Alice mentioned, so I'm not going to say it again for you. But again, it's that peace of mind when speaking to the registered managers. You know, someone even said to me, I'm actually quite excited for CQC to come in because we required improvement before, and I know that we've made improvements with all of this work that we've done, and I want to show that off. So actually that was I'm somebody who's nervous around examiners and things like that, but that was, you know, if they're that confident, that was really something that we wanted to highlight. Next slide for me, please. Finally, again, I wanted to finish on some more quotes. So we know that not all of it's easy, right? So when I was doing all the visits, I said, I want to know the good, the bad, the ugly. I want to know everything. And migration came up as being tricky. We know it's not easy and it's not fun, but every single person I spoke to, I asked every single one, would you go back to paper? Not a single person said yes. Everybody said we would be lost without our system. I'd never go back. Lots of people actually are now asking about other types of technology. I mean, the number of people that said to us, I was worried I was going to lose staff. You know, people were panicking about everything. And actually now, even, you know, the tech dinosaurs, as people call them, are loving it. They find it really easy. It's brilliant. So that, hearing that from the horse's mouth rather than us just saying it, you know, hopefully you'll believe it more from the people doing it, but actually that everyone has said it's been a positive change, whether it was easy or difficult to begin with. You know, just taking a couple of weeks to get used to it has absolutely changed how they do their work. Some other benefits that I wanted to highlight, again, which I cannot necessarily measure, is that reassurance from family and support systems. Now, the example I had that I was told about was a daughter had come into the registered manager of a home and said, I've noticed a bruise on my mum and I didn't see it a couple of days ago, and she wanted to raise a complaint. If you go back one more slide, just because I haven't gone to that bit yet. And she said, I want to raise a complaint because there's a bruise I've noticed. The manager said, just come in my office. Let's just sit down and have a look. She brought up her mum's record. She showed the daily interaction where the bruise had been identified. She showed the body map. She showed the picture where the care worker had added all of that information in. Days ago, previously, that it had been worked on, you know, she said, we can't edit this information. This is when it was added. This is how you can see it. She showed the call with the GP. She had all of that interaction all on the system. And it actually also had tried to call daughter, left a message, didn't get hold of her. Immediately she said, wow, that's, you know, I'm so glad you saw it. Thank you for letting me know. You know, I obviously don't need to put that complaint in. That's something that registered manager said, actually, it's really good that we know we've got that in our back pocket if we needed it. That reassurance of any sort of issues, they know that they have that should they need it in any sort of situation. So that was another sort of way that, just for you to have as something to know, it is another way to potentially reduce complaints or reduce safeguarding incidents and things like that, because you have all of the information on hand. And final slide, please. This was one of my favorite visits, and it was Neurodiversity Week last week. So in honor of that, I finished on this quote. This is an activity coordinator who'd done her job for 25 years. She loves her job, but she wanted to be an activity coordinator. She didn't want to be an admin. you know, frankly, and she hated that side of the work, so much so that it gave her panic attacks because she got so stressed about the paperwork. She is severely dyslexic. She's also autistic and dyspraxic. So actually also the paperwork was really, really difficult for her to do. She used to push it off for weeks. So actually from that side of things, the paperwork was often out of date. Now, she's saying that actually she doesn't have that at all. She uses dictation religiously. She has found that there is a specific device that understands her accent best. She's quite northern, compared to me, definitely anyway. So she's found that she was coming in early to make sure that she got that specific device. Her manager has now let her have that as her own device. So they've made an allowance there for her. She's said that she literally doesn't have to worry about spell check. She doesn't have to make sure that any of her grammar's right. She uses that voice to text, and everything is there. She says she used to be so embarrassed by her work, and actually now she's proud of it and she wants to show off her work. She doesn't have to work over. She was working 12-hour days and coming in at weekends that she didn't work just to catch up on her paperwork, and now she just doesn't have to do that at all. So, you know, she's also not having panic attacks about her work and, you know, enjoying it more. So I think just really to follow up on, you know, yes, it saves you time. Yes, it's good for CQC and the tick boxes that we all have to do. Yes, sustainability, you're going to reduce your paper and your printing and all of those things for those ticky boxes. Great. From my perspective, with the data, the ticky boxes that I have to do, great. But from a human being perspective, you know, hearing these stories for the last 6 months, I'm going to miss going out and about and doing it, because it makes you feel and see why, you know, your work is worthwhile doing. And if a system can do that, I just think, why wouldn't you do it? So there are a couple more slides, but it's literally just contact information. So the next slide is reiterating what Alice said. If you're thinking, why the heck haven't I done it yet? There's our website. The second is for all of the local ICB contacts. The third is the YouTube link, and then there's my email address if anybody has any questions for me. But I will be staying on later, so obviously Katie will pick up any questions. Thank you for your time, everyone.
Great, thank you so much, Louise. I think it's just really, really helpful to sort of have it laid out in that way, and kind of, you know, many of us, I'm sure, have heard some of the benefits anecdotally over the years, but actually to sort of see that's being brought together consistently from multiple providers across the country, really helpful. And got, as I mentioned, a couple of care providers on the call today who are going to share their experiences, so I'm sure they will pick up some of those. Had some lovely comments in the chat, just to let you know, Louise, make sure you do have a look at them. Penny saying that it's such a great news story, so thank you. So without further ado, we're going to go into sort of, rather than the national picture, talk a little bit about what's happening, well, I say locally, but Nottingham and Nottinghamshire is quite a large county from what I understand. But I'll pass over to Jennifer to talk about what's happening in Nottingham and Nottinghamshire ICB.
Thanks, Katie. So hello everyone, good to meet you. So my name is Jennifer Allen and I'm a project manager with the Nottingham and Nottinghamshire ICB. I actually belong to Nottinghamshire County Council. I was a project manager with them, and then I've been seconded over for just over a year to kind of to support care providers to consider digital social care records and other kind of digital innovations. And Andy Griffin, who is the owner of the Helping at Home domiciliary care agency, has joined me today. So we're just going to give you a little bit about our perspective. So I thought I'd just start with just a little bit of context about Nottingham and Nottinghamshire. So first map there, just so you know where we are, with a red blot in the middle. I'm always constantly surprised actually about how far up the country we actually are. So I'm not testing anybody on this sort of later, but it was just in case, just to sort of show you. So we're pretty landlocked. Picture in the middle just gives you an idea of our makeup. And actually, in some respects, we've been very lucky from a kind of a process management point of view, that we're a pretty sort of straightforward ICS. So we just have 2 local authorities here, the City of Nottingham, as you can see in sort of pinky colour, and then the rest is the County Council area, which is sort of split into those sort of 3 areas. So in terms of how we kind of support the transfer of funding, the County Council actually agreed to kind of hold on to the money for all of the ICB, and then I'm able to make payment requests to draw off that money to kind of pass on to providers. So I do appreciate we've been sort of quite lucky in some respects. I'm just supporting one ICB, and it's pretty straightforward. The County Council and the City Council are kind of polar opposites in terms of kind of political perspectives, but there's actually a lot of empathy between the 2 local authorities, and the officers know each other sort of well. So that's all helped extremely well in terms of sort of promoting what's on offer to care providers. And then just at the side, the last picture was just an attempt to show you kind of where Andy's organisation are based. So Andy helping homework out of Newark, which I think if you were going to look at the middle map, I think it's where my geography's not very good, but that's sort of like blue sort of little blip that's making a break for Lincolnshire. I think Newark's in there, isn't it, Andy?
Yeah, I think you've nailed that. Yeah, absolutely.
Yeah, so that just to give you a bit sort of an idea. So anyway, across our patch, we've got about 585 care providers. Obviously fluctuates from sort of time to time, and that excludes some dormant providers and some perhaps that are just are more sort of newly registered, but that's about the size of the care market that we're trying to support. In terms of the overall target for digital social care records, that means we're trying to aim to get 466 providers onto a digital social care record, and we're about 63% of that. So in terms of numbers, we're just under sort of 100 short, but we're already working with about 85 providers. So I'm sure we'll get there by the end of the scheme. So we're in the thick of it, I would say, at the moment, if you wanted sort of a rough assessment of where we are. So just alongside the, sorry, Steph, so just alongside the digital social care record support that we've been offering to providers, there's obviously funding available there, but we've made sort of links with people that can provide support around connectivity. Nottingham and Nottinghamshire with Derby and Derbyshire are part of a like an East Midlands engine project to look at sort of a mayoral district. So there's lots of kind of broadband sort of infrastructure support that we've been able to sort of draw on for advice and guidance for one of our care providers. So yeah, it's not just about the money, there is other support that we can sort of offer to people. Alongside looking at digital social care records, we've also had a couple of other funding streams that we've made available. One for residential care providers who wanted to look at investment in sensor-based or acoustic monitoring falls tech, and one that we called sort of care at home, which was really to make sure that domiciliary care providers didn't miss out, and really we were looking for innovation through some sort of digital means in the way they support people. What we decided to do in our ICB was go with sort of like a digital social care record, where we've offered a contribution towards providers that wanted to sort of make their own investment in care at home or sensor-based falls tech. So I know like other ICBs have looked to kind of procure you know, supply themselves and offer that to providers. So I think there's, you know, kind of pros and cons in both that different ICBs are finding. I think we were surprised that it wasn't more popular, perhaps those two funding streams with our local care providers, but marvellously Andy was interested, which has meant that I've met him and been able to sort of bring him along today to speak to you. So if it's okay, I'm just going to spend sort of the rest of our time posing kind of questions to Andy so that you really get his perspective as a care provider, in terms of, you know, what it's been like, what it's all about. So the next slide is a bit of a plot spoiler, if you don't mind going on to that. But Andy and I have sort of talked about these sort of before. So Andy, if you're happy to sort of move on to these, I'll make a start. So yeah, so just first question, obviously everyone can sort of read it, but, you know, from your perspective as the owner of a domiciliary care agency, what was the most important thing for you when you were choosing the right digital social care record for your team?
Well, firstly, thank you for having me, and hi everybody who's on mute and watching. Thank you for your time. I think this is a really tough question, but to give a fairly quick answer, I think we always, and we're hopefully, I'm sure, in common with many of the audience, we've got to consider all of our stakeholders whenever we make a big decision about the way the business operates. And I think you can distill that into moving forward the digital care record system. First of all, has to be a benefit medium term and long term to us. We were kind of prepared that we were going to take some short term pain just because of a change, and I think that was discussed a little earlier on as well. But actually, for our stakeholders, you can kind of put them into categories of, first and foremost, our clients, or service users, some say, but our clients are our first stakeholder group. Our obligation morally as a business, and also from a regulatory perspective, is making sure we're giving the best possible care to our clients. So what difference does a digital care record system do? What difference does it make? How does it move the needle for our clients, was the first question. The second, and probably really up there with our clients, is how are we benefiting our team by investing in a new digital solution? There's a lot of kind of different areas of that. Are we making the team's job easier? Are we making it more transparent for the team? Are we able to update the team quicker and also respect what the team know about each of the clients that they build that incredible relationship and incredible bond with? I think the third group is our partners. So I think most of my co-hosts here from the NHS, from other elements of the care pathway for each individual client, whether they be OTs, physios, GPs, hospital discharge nurses, for example, the whole gambit of care and health professionals that will engage with that client along their care journey. And then finally, and I'm sure most importantly, especially if anyone from the CQC is listening, it's the CQC. We, along with everybody that's regulated, take our obligations incredibly seriously. So we also balance that by there's a huge amount of admin required to make sure that we are not just compliant, but we're living the themes that the CQC expects us to, with the new digital assessments that have been rolled out. A couple of recent emails in the past week or so that are it maybe not proving as easy as CQC hopes to roll out a new assessment framework. Nevertheless, a digital care system should enable us to be able to evidence quicker, more completely, with more transparency, be able to align what we're doing and be proud of the evidence we put forward against the relevant care questions that are asked and we need to respond to in a consistent fashion. So there are stakeholder groups. We've got to feel on their behalf and for us as a business as well that there is a benefit, and we're working towards greater benefits as time goes on. And I think from an operational point of view, there's some basics in there. Any investment we make anywhere in technology has got to save us time, it's got to save us money, it's got to enable us to be more accurate. And I think, as another panelist said earlier on, this isn't about losing people out of the business, it's about redirecting where their time's best spent, and predominantly that's all about making sure that our guys can care for our clients better and better. And the final point is confidence. We've got to ensure we've got a team who are confident in using a new system.
Super, thanks, Andy. So marvellously, the first stakeholder group that you identified was the people that you're supporting. So I don't know if you just tell us a bit about. I think you went. Your aim was to go pretty digital pretty quickly when you set up the organisation. But what sort of feedback do you get? Any feedback from the people that you're supporting, or perhaps their families and advocates, about the digital social care record?
Yeah, absolutely. So we used one particular. Am I allowed to name the system, or is this kind of a BBC situation where I can't? Other systems are available.
You're allowed to name systems, but other systems are available. Just we're doing both sides here.
Okay. So we use Birdie, and many other systems are available. With Birdie, and I'm sure other systems as well, it's a really simple question to answer, because family members and clients, they get an instant connection with us just via the app. So there's kind of a family circle app that allows the client, for a start, assuming obviously they have capacity, and also their family members, whether they live next door or whether they live at the other end of the country, or in one of our clients' cases, their daughter lived in South Africa. So we were conversing on Teams with the daughter and the mum in the mum's house to set up the care plan initially. And then every day the daughter could check in. The time difference isn't too vast. So when she woke up for breakfast, we'd already done the morning call, so they could check in almost immediately on how's mum, how's her mood, what's she eating for breakfast, is she out of bed, has she had her personal care done, and I think the feedback we've received from clients who are distant, or clients' family members who are distant, it kind of gives them something to talk about, something to engage with their mum or dad or loved one about. So that's a really specific example of someone that is literally thousands of miles away. More locally, family members especially, when we start working with a client to start serving them, we need to gain their trust pretty quickly. And if they can see very quickly what we're doing, how we're doing it, who's been to see mum or dad, what they've spoken about, how the care plan in that first week or two is evolving based on just us getting to know that client more and more, it really helps to build that trust very quickly. And that means that we can evolve the relationship. We can evolve the relationship into, well, how can we make their life as enriched as possible, not just support them to get through day to day. So yeah, they, in general, love the closeness they've got with their family through the platform that we bought.
Brilliant, thank you. And then just lastly, I know kind of colleagues that have gone before us have sort of talked about the benefits, but just in terms of your perspective as the owner of a business and your team, what do you see as the kind of the key benefits of having moved over to a digital social care record as being?
So probably two categories for this. The first is operationally. From a regulatory perspective, we can be really specific about the evidence categories that we're capturing without even having to think about it. You capture the evidence, you tag it, and then it's ready to look at by an inspector, by you internally when you review it. The immediacy of being able to amend and alter care plans and roll it out immediately, whether it be a MAR update without having to ring the next carer or converse via a popular messaging platform. You can update the MAR there and then with the carer in the home, and you can administer those drugs, assuming everything is fine with that. And the same for more extensive care plan updates. It's an immediate update, which allows us to be ever more person-centered and kind of not just tick that box, but live the theory of it. I think it's really important, the point that the lady mentioned earlier on about carers can just use voice to text to crib their notes. You don't need to be sitting in for home or domiciliary care agencies. You're not sitting in someone's house writing down in an A4 foolscap folder, which is really quite uncomfortable. And it's also a point in time. No one else can see it until they go to the house the next time. You can voice to text on the way back to your car to grab a coffee, and it's accurate, it's fresh, and immediately we're seeing what happened in that visit. I'll go through. Speed of setup for care plans. Example this week, we're very fortunate to have a new client this week who is currently in hospital. They're due to come out towards the end of the week. Our deputy manager and a care coordinator are going to go and see that client or that potential client. They're going to be able to create the care plan the second they land back in the office. One can do it on the laptop while the other one's driving, if they so choose, not while they're driving, obviously. They can start to do that immediately. And actually, if that client is able to be discharged, it helps the whole system, because we can have them in their home supported that evening from a visit in the morning, which is just very difficult when you've got a paper-based care plan. You need to get sign-off from the clients, etc. And then just generally, I'm a bit of my previous life was in technology. So I'm a passionate supporter of anything that makes our life easier in technology. We've got to embrace. And I just kind of feel that our care management solution is the heartbeat of our business. It should be able to do ops, regulation, finance, payroll up to gross, regulatory compliance, HR, policies, procedures. It should have the whole gambit. If it does that for us and it becomes the heartbeat of the business, although I guess the best way I can probably compare it would be, it's like having the topical potholes in the road. For the first couple of days where you've got someone repairing the potholes, it's going to be annoying because you've got a contraflow, or, you know, you're going to be put out a little bit. But once those holes are repaired, you have got a really smooth highway. And that's kind of where we are with our system now. We had a few weeks where it was kind of, how do we get used to this, everything being done differently? But now we wouldn't be without it from across the organisation. So yeah, really happy, and thank you for your support.
Excellent. Thanks for that, Andy. So I'm just going to quickly move us on, if it's all right, Katie, just if we can have sort of a couple more minutes. Steph, I don't know if you can take us on to our next slide. We were also able to support Andy's company with a small contribution towards trying some sensors linked to an insight system. So Andy had chosen Amber UK, which I think Hampshire and the Isle of Wight have also sort of tried on a sort of a grander basis. So essentially, Andy's had quite a lot of success with sort of the insights that his organisation have sort of seen through the use of those sensors in sort of people's homes. So I think we can only afford you a couple of minutes, Andy, but I don't know if you want to pick your favourite example, or just tell us a little bit about your experience with the Amber sensors.
Yeah, absolutely. So I think Amber or other solutions are available. Amber have been great for us. We also work with a couple of other platforms as well, just depending on the client's need. But each of these platforms, they can be our data gatherers. I won't use the word eyes and ears, because they absolutely, certainly the sensors that we've used, don't have cameras, don't have microphones, so they don't invade on someone's privacy. They're just gathering data about how well someone slept, what the movements are in the day, how warm the property is, when the front or back doors have opened. So really quickly leafing through these, the person supported letter A is a lovely fellow that unfortunately is presenting with early onset dementia. We've by using the sensors, the platform in place, we've been able to support the daughter as much as the father in making sure that she feels assured that he's comfortable at home and he isn't opening doors at 3 o'clock in the morning, for example. And also we've been able to support him through understanding his sleeping patterns and understanding that his sleep apnea was really quite severe, invited an OT to come along. They supported his sleeping with them, and he slept a lot better and was a lot more supported. So that was what's
well, perhaps if you don't mind, Andy, we'll perhaps leave sort of the other ones for people to read. But I mean, you're definitely an advocate of the use of the sensors, aren't you, to sort of improve the experience that you're able to kind of.
I think it's the next stage of care, to be honest. Yeah, we're really embracing it.
Excellent. Thanks so much. So just our next slide, last slide, is just our contact details. So Andy and I are happy to talk to you about this sort of stuff all day long, although obviously Andy is a busy man. He's got a company to sort of run. But we both said, if anybody wants to sort of kind of contact us outside of this meeting, then we'd be more than happy to kind of, offer you support, speak with you. So just get in touch.
Wonderful. Thank you both so much for that. I appreciate it. It's a bit of a whistle-stop tour for people who are listening for the first time, because it's quite a short webinar, this one. But as Jennifer said and Andy said, there's a lot more information out there. We'll make sure you get slides of those other case studies with it on as well. And there's sort of resources at the end of our slide deck as well to let you know about how to sign up for newsletters to get more information as that becomes available. So thank you both. We've had some questions come through, which we'll come to at the end. But first of all, we'll go to Shropshire on the other side of the Midlands, though not as high up in the country as I've discovered Nottinghamshire is, apparently. And Fiona, over to you.
Good afternoon, everybody. Welcome. So I'm going to talk to you about what we've been doing in Shropshire and Telford and Wrekin. I'm also going to introduce you to Debbie Price, who's the CEO of Coverage Care, who has taken advantage of the DSCR solution option and has introduced it in 11 of her care homes. So can I have the next slide, please? So Shropshire and Telford and Wrekin, ICS, we started our funding in January 2023. So we're a little bit late to the party compared to some other ICBs and local authorities. But we certainly haven't delayed the support we've been able to give. We've certainly hit the ground running. So obviously, as everyone knows, the DSCI allows digital recording of care information, and you have to work with an assured supplier to be able to receive the funding. So they're now in excess of 20 assured suppliers on the DSCR system. However, you do have the digital toolkit to be able to drill down and shortlist. So certainly don't look at the amount of suppliers there that as a barrier. Look at it as an opportunity to have freedom of choice and to be able to get the solution that best fits your particular, whether that's care agency or care home. So it is expected to be used to pay for the year one costs of implementing a digital social care record, including training and data transfer. So that is something that people don't necessarily understand and take into account. So you can use some of the funding to be able to do your staff training and data transfer. Even if your assured supplier doesn't charge you for training, you're still going to incur a training cost by bringing your staff in to be able to train them. So that's something that you certainly do need to bear in mind. In Shropshire and Telford and Wrekin, we are match funding up to £150 per bed or person in the community. That is capped at £150, which is around about the national average, which is between 140 and 150. It doesn't cover costs for hardware, routers, servers, or Wi-Fi or networking, or electronic devices, unless these are integral to the actual software that you're purchasing. Next slide, please, Katie. So where are we at right now? So we're just literally less than a week away from the end of year 2. And like I said, we didn't start until January 2023. However, we've managed to get 94 expressions of interest in Shropshire and Telford and Wrekin. Now, compared to some other ICBs, excuse me, lose my voice, it does appear that that is quite low. However, Shropshire is actually one of the most rural, and we actually had the smallest budget in the whole of England. So we are quite small, but to get 94 expressions of interest, given that we had a target of 68 in the first 2 years, is actually really good. We're really pleased. So we've paid out 76 funding bids of just short of £331,000. So as you can see, we're certainly supporting our local care providers to ensure the solution they're choosing, they're getting as much funding as possible to be able to support them with that. And we've currently supported 2,300 individuals to have their care planning delivered and supported digitally. So that for me is a huge figure. It's the fact that those people are no longer having their care plans on paper. Obviously, you have the option of family members, friends to be able to have a look at that. You've got practitioners that are able to look at the digital solution. So the fact that that many have got their care now delivered digitally, I think is amazing. So from our perspective, I just wanted to say what has worked in Shropshire and Telford and Wrekin, but also I'm very aware that there are ongoing challenges and barriers. I would be very blinkered if I didn't admit that. So what's working is completing visits to those starting out their journey and those not engaging. So what I tend to do in Shropshire and Telford and Wrekin, like I said, we're very rural, cover 320 square miles, but I'm not afraid to get in my car and go out and about. So yes, I'll do an initial introductory email, introductory phone call. But one of the things I do is I offer to go out and sit in the care home or in the agency office and have a chat about what the DSCR benefits are, how it can help the company move forward, and obviously the difference it can make to the individuals that are receiving care. So obviously I'm updating our home care register. We have new care agencies that are coming up on the DPS all the time. So again, just because you're new, it doesn't mean to say that you can't apply for funding. We have a conversation around when is the best time for you to be able to do that. And again, that seems to be working very well. What I'm also doing is partnering up providers who are looking at suppliers. So as I've said, there's in excess of 20, and it's a very difficult decision. There can be 2 or 3 that, they all look like they can do what they can do for me. How do I know they're going to be able to deliver what I need? And as we all know, a salesman can be very good at selling a product, but actually engaging them with a mentor and somebody who's already adopted that product, is using it on a daily basis, has overcome the challenges and barriers, but has also made the system work for them. So what I do is I partner them up. So if they're struggling to make a decision around 2 or 3 suppliers, I will contact a provider that's using one of those suppliers and put them in touch, make that contact, and then they're able to either have a phone conversation, or some of them actually go out and look at the solution in situ, so they can see how it's best working for them. So again, for some that are slightly reluctant to go down that road, then that is a really good tool for partnering up providers. And communicating out any new initiative and funding streams as they become available. Gigabit vouchers was a prime example of this. Shropshire, as I said, is one of the most rural counties. However, none of our care homes actually qualified as under the gigabit vouchers. It said we were urban. Very frustrating, but if there's funding out there, I will always share it. So I'm also working with partners in care around the digital security toolkit and digital social care records. So under the scheme, you have to either be working towards or have achieved a DSPT. So what I'm doing is partners in care through the Better Security, Better Care Fund are supporting care providers within Shropshire and Health and Wrekin to achieve their DSPT. Following on from that, it's a really good opportunity. They've already built that partnership. They've already built that relationship. So they're then having a discussion around digital social care records and putting them in touch with myself for me to be able to have a good conversation. What I'm also doing as well is meeting with assured suppliers and challenging their costs and understanding of the care market. What a lot of assured suppliers do is they assume that every care provider is the same, and they're not. So it's having a greater understanding of that care market and challenging them and pushing back to them and trying to make them understand the challenges that you have, certainly from a sustainability perspective. So that is working really well. So ongoing challenges and barriers then. So number of assured suppliers on the list. You know, I'm very aware that there are some smaller providers. They don't have time to sit and look at 20 demonstrations and also consider whether or not that's suitable for them. So it is an ongoing challenge, and you have to acknowledge that. Some of the small independent care providers and also some of the larger ones are struggling with infrastructures. We don't provide funding to be able to upgrade infrastructures. So again, that's something that they are really struggling with. Resource and time for care providers to gain quotes. Yes, you can shortlist down, but again, if it's shortlist down to 6, there's 6 care providers, there's 6 assured suppliers that you need to contact. You have to gain quotes from them. You have to look at demonstrations from them. And some of them are taking a long time to provide demonstrations. So what I'm saying to people is when they start their journey and we have that initial discussion, if you haven't had a demonstration within 14 days, come to me. I will certainly push a few buttons and make sure that demonstrations are put forward a lot sooner. Because again, I'm very aware that time is precious. And for care providers, once they start this journey, they want to be able to complete it sooner rather than later, rather than it drag on for a long period of time. Funding available. As we all know, the funding has now been announced for year 3. But apart from the first year implementation costs, people do need to ensure that whatever solution they choose is sustainable from year 2 and beyond. It's all very well if a solution is great for them today and me providing 50% means they can afford it. But if it's not sustainable in year 2 and 3 and beyond, then that's not going to work for them. What I'm also advising is that care providers look at future-proofing themselves. So some of them are struggling to make a decision between 2 or 3 assured suppliers. And what I'm saying to them is, yes, it might work for you today and it might work for you next month. Will it work for you in 12, 18 months, 2 years, if at some point a shared care record becomes reality? And there are some assured suppliers that, yes, if the button was pressed tomorrow, they're ready and they have that integration capability. Some are nowhere near it. So what I'm advising them to do is to look at the future and not just consider today. Because what I don't want is certainly some of the smaller providers struggling then with software updates, development costs, because their assured supplier does not have integration capabilities. And care providers understanding the benefits of a digital system past the paper savings. You know, as Louise has said, you know, we can do a lot for our carbon footprint, and we can save a lot in paper. The 76 that have secured funding in the last 13 months have projected they're going to save just short of £160,000 in printing and paper costs alone. £120,000 saving in admin costs, which can be used to redeploy in other. It's understanding the benefits past that. It's understanding how it can benefit your business moving forward. Yes, from a care planning perspective, but also staffing levels, looking at how you can move your business forward, ensure it remains sustainable. As was already been discussed, the CQC self-assessment portal, ensuring that the way you deliver your care and the way you record it is the best possible way for you to achieve the best possible CQC rating that you can. So that's it from me. I'd like to introduce you now to Debbie Price, who is the CEO of Coverage Care. And as I said, Debbie has taken a solution for 11 of her homes in Shropshire and Telford and Wrekin. So Debbie, over to you.
Thank you. And thank you for the invitation. It's going to be really hard not to be repetitive, really, in some of the messages that you've had. I think having 11 homes, and they're all within Shropshire, Telford and Wrekin, we provide services to people, to just under 700 people, and I have just over 1,000 staff. So it felt like a very big move to introduce digital care records in our organisation. We decided that we were going to invest in this, and used Fiona to support us in being able to drill down the providers, and finally chose ours. And the one that I chose was somebody that I felt would work with us and develop their software system to meet the ongoing changes that would be happening within our business, because we had I felt were some very good paper records that I wanted to translate into a digital solution. And they have been absolutely excellent at working with us to, if you like, personalize their system to our business. And that's been really key to us having confidence in working with them. I think culture change is not to be underestimated. How you introduce this to your business, and particularly where you've got more than one site, so you have a consistent approach, is really essential. And so getting the managers on board, making sure that they really wanted this digital care record system, could see the benefits, understand immediately the messages that needed to be portrayed to our residents, to our family, to their families, to our staff, was really key. And we spent a lot of time preparing the business, if you like, and the people within the business to understand what we were doing and why we were doing it, and what we felt the benefits were going to be. And so we did do that for a couple of months prior to then having an implementation program of a couple of homes a month, coming on board and starting the digital care records. Lessons learned, I have to say, is make sure that you have got plenty of designated hardware laptops for the implementation of uploading your paper records onto your digital solution. And those laptops are separate to the running of your business, really, because I found it was much easier to have designated staff home by home who were backfilled and given time to sit and upload the paper records, because at that point, for me, it was also that quality system check that you knew that what was going on to the digital care record was up to date, it was accurate, people had been reassessed at that point, so that I knew that the data was in real time at the point of it going on. We had considered maybe getting people in to upload the data for us, but on reflection felt that actually we needed to be assured that that data was right. The managers were the driving force, and really being able, we had a lot of sessions with them prior to going live so that they fully understood the system, so that they were able to troubleshoot within their own homes, and to be able to reassure staff about using the system and the handsets. We had staff who were very resistant to change and to implementing this. And so we worked with them before it went live so that they fully understood the system. They knew how to use the handsets. They knew how to use the icons, what it would do, what it would do, where it would take them. And they became our champions. So we had champions in each of the homes that we sort of set up and trained prior to going live. And they then became the go-to people in the home. So having got them very confident, we were then confident that they could support other staff, particularly the new staff that come in after you've implemented it. And sometimes you can forget it's this ongoing journey of constantly, introducing people to something that is new and different. We found the fact that you can use voice to translation really helpful. We do have staff whose English is not their first language, and so being able to use those translation modules have been really helpful, because they can read back what it is that they're wanting to say, know that it's accurate, and it then gets transcribed into English. So particularly for those new staff coming into from abroad, that's been really, really helpful while they settle in and use that and develop their English skills. GDPR is really, this really supports GDPR. So when you're setting up your systems, you can set up your permissions for who can see what, where, what levels of information can be shared, and you can constantly go in and reevaluate and rechange that, and you can change it. So it's been really, really supportive of us making sure that the right people have got the right information at the right time. As we've got used to using it, we're now introducing surveys. So CQC are wanting to see ongoing sort of live feedback, really, and we're getting a bit more comfortable in setting up surveys to ask really short surveys, asking very pertinent questions that really help us to sort of shape how we continue to use the digital care record and develop it. I recently sent out, as we've introduced this sort of from summer last year through to the last home going live now, a very quick survey, just wanting to know how the staff felt about the system that we're using. So I asked them whether they were confident in using our digital care plan system. Of the 1,000 staff that were able to answer, I had 650 staff so far answer it, which I was really pleased with. And 92% have agreed that they are very confident in using this system. The ones that were less confident are the ones that have only just gone onto it. So I'm quite confident that in 6 months, if I rerun this survey, I will have a much higher percentage than that. I've asked them whether they agree that the digital care system has improved the quality of the records that we keep. 98% have come back agreeing that they felt that they are far more robust, far more detailed. They are recording in real time, and that means that they are able to be responsive to people in real time much quicker and much more effectively. They're far more responsive. And then I did ask whether the digital handover enables them to keep more, up to date with resident changes and their needs throughout their shift. And 91% have come back to say absolutely, it is far more effective than the verbal handover at the start and the end of a shift. So introducing this system has been absolutely transformative, really, and I place myself in that digital dinosaur category. It's taken a long time to get there, but I would not go back to paper records. They absolutely are changing the way that we're working. They are making us as a company daily be more responsive to the needs of the business. We've set up monthly sort of top tips, really, with the managers, where either through Teams or face to face, we're getting together, we're looking at the system, we're looking at how we're using it, we're standardizing decisions about how we are modifying it to meet our needs. So we're looking at, you know, what we want, how we want it, what reports are coming out. We're looking at themes across the whole company, not just within care homes. And then we're making decisions on how we're changing practice and policy. So it has fundamentally changed how we're running our business. So I think that's probably all I've got to say, to be fair.
Oh, well, thanks, Debbie. That was great, and just so amazing to hear as well how it's working across all of your staff. I can't believe that response rate to a survey. I know trying to get any kind of survey responses is a nightmare normally, so that's fantastic.
I mean, the survey's on the handset, so when they come onto shift, the questions are there. It takes 1 minute to, you know, just to tick the boxes, and we're finding that being able to send memos to staff, so you've got information that you want people to know straight away. It's there. It's on the handset. It's immediate. You know, you get responses. They get the information we need them to have. They're responding straight away. It actually, you know, really has transformed how we are managing our services.
Right. Well, thank you so much, and thank you to our speakers. But I could ask all of our speakers to come back on screen now. We have had some questions which have come through, and also just because Karen, could I ask you to introduce yourself, because you joined a little bit later?
Hi, yeah, apologies for that. I'm Karen Buttle. I am a programme manager in the Digitising Social Care programme. So I work with Alice and Louise. I cover the North East and Yorkshire region alongside the North West. So I will pick up some questions. In fact, I was just manically typing a response in the chat about the question around retrospective funding. So
I was about to say, actually, should we maybe start with that one? So we have had a question through from Will, who works for both a care home and a dom care company, currently using two different systems on the Assured Solutions list. Would an ICS consider supporting or providing funding for something which has already been implemented?
Yeah, so from a national perspective, we say this is a decision for an ICS at a local level. There are many ICSs that do not offer retrospective funding, regardless of the date that the assured system was implemented. And this is because principally we are programmed to take people from paper to digital. So if they are already using a digital system, then they already count towards the adoption rates. So it is a local decision. You could ask the question, but do not be surprised if that ICS says no, they wouldn't be able to provide you with any retrospective funding.
Thanks, Karen. That's helpful. And I know, Fiona, you'd also popped in the chat. So from a Shropshire perspective, did you want to come in at all, or Jennifer from Nottinghamshire?
Yeah, I mean, from my perspective, like I said, our fund started very late. So our fund didn't start until January 2023. So if someone is implemented from April 2022 when the fund was launched, I personally wouldn't penalise in Shropshire and Telford and Wrekin if they applied retrospectively for funding, because we weren't in a position to be able to offer funding between April and January. So I have had a couple that have applied for retrospective funding in Shropshire and Telford and Wrekin, and I have awarded.
Thanks.
And then I would say for Nottingham and Nottinghamshire, we were even later than Fiona. We didn't really get our payment system in place until about July 23. So we did the same. If people had, you know, implemented after the 1st of April 22, we did support them with a contribution. But now I've got to confess that I sort of say, if you're moving or you've recently moved, because to the best of my knowledge, I think we've worked through those that would have sort of fallen into that bracket. So, you know, now we do focus on those that are, like Katie described, moving from paper to digital now, or, you know, just recently. So that's where we focus our support at the moment.
That's fair. So I guess the main takeaway is contact your ICS. The link on how to contact them is in the slides that you'll receive after this. It's always worth an ask, always worth getting in touch. We do have a question as well, specifically for Andy. So how do you ensure your clients who don't have access to digital devices for any reason continue to have access to their own records?
Yeah, great question. In that situation, it's just always a bit of a hybrid. Although I would be delighted to never see a printer again. I think the harsh reality of the world is we just need to, and we're dealing with such different approach to technology and generations that in each of our, we still print out care plans once and we put them into clients' homes. And when they're updated significantly, we take those out and reinstall them. We also, when needed, we print out weekly rotas because clients prefer on occasion to consume them that way. Others will accept a PDF, but when they want to print out, and the same with an invoice, we're still obligated to deliver our services in a way that our clients want to consume them. So yeah, we're still flexible, although I get very grumpy near a printer.
I think printers are some kind of black magic. I can never figure out how they work, Andy, and I'm quite tech savvy, I think. Debbie, actually, this is probably also a question for you. How do your residents feel about sort of having their care records available digitally? Can they see them in that way, or do you still do printouts for residents who want to see their care plans?
We can print out for those that want to see them, although nobody has asked to. I think because you can have them on handsets or on tablets, and we can take, for those that are able to view them, a lot of our the people that we support actually don't have capacity. So we would take the tablet to them, or we've got the digital tables, so very, very large. We can take that into their room. We can show them their records. They can have their care reviews with their families remotely, and we can give access to the families to be able to input into the care review with their loved one remotely as well, so that we can record all the information, and we can get our residents to sign the care record at the point of delivery if they want to show consent and to show that that whatever it is that they're doing has taken place. So it's very personalised, really. Some people will take will engage with that. The majority of them, as I say, don't have capacity and aren't able to utilise that option.
Thanks, Debbie. That's very helpful. For anybody who's really interested in accessibility around digital social care records, the Caring View podcast and YouTube channel did an entire episode a couple of weeks back now, which is available on YouTube, all about digital accessibility, particularly for anybody who's from a working age adult service or learning disabilities. They cover accessibility quite a lot there. Sorry to send you off to a different resource, but I recently watched that and found it fascinating, so something to check out. We have also had some interest because a couple of you mentioned voice to text function. The question was asking you to recommend specific apps or systems, which I know is a bit problematic for many of you on the call to be able to do that. But I wonder, maybe from a national team, is sort of voice to text one of the capabilities you're looking at in terms of the assured solutions? Can people search by that as functionality if it's important?
So it is one of the requirements for a digital social care record on the assured supplier list to have a voice to text capability. So everyone who is on the list will have that. And a number of them have like a translation option as well.
Great, thank you. And is it something, I guess, Jennifer and Fiona, when you're sort of working with care providers locally, is that something which is a priority for care providers to use?
So for Nottingham and Nottinghamshire, I've spoken to providers who have sort of, applauded sort of the benefits of it, but I can't say it's really come forward as like a priority in terms of the search that people are making for what's going to best suit their organisation. But I do know organisations that have benefited from it. I think a colleague mentioned earlier, if written language isn't your forte, or if English isn't your first language, it's a definite sort of bonus to have that sort of option.
Brilliant. Thank you for that. That's really helpful. At the very beginning of this call, if we think back, Alice mentioned about there's now over 60% of CQC registered care providers who have a digital social care record. Joe has mentioned in the Q&A that there's a bit of a discrepancy between capacity tracker data and PIR data and what their local data is. This is an external call, so we don't need to get into the details of the data, but maybe you could talk a little bit, Karen or Louise, about sort of the questions in the capacity tracker or the questions in PIR and how you're collating that data nationally. And then if there's sort of specifics, we can kind of set up a call for a bit more detail afterwards.
Yeah, so unfortunately, the data that comes out of PIR and capacity tracker is only as good as what is inputted at source. So it's only as good as the information that the care providers provide. And unfortunately, what we do know is there are a number of care providers that don't complete the PIR request. There are also a number of care providers who have done capacity tracker but haven't necessarily answered all of the questions within the capacity tracker itself. So there are issues as far as data is concerned. The data that we have been sharing onward, so we share monthly, it's possible for our ICSs on the programme to be able to download the PIR data that gives them the adoption rates. That data is only completed obviously on the anniversary of when the service was registered. So we know that that data is always sort of 11 months behind. So there is an issue with that and the lag. The capacity tracker data is much more up to date. We have been working to try and get the agreement around sharing capacity tracker data out. So we have been able to share some data with our ICSs in the last couple of weeks, and we are working to get access for the ICSs to be able to view the capacity tracker data themselves. We expect that to be ready in early spring. So I'll say hands up, you know, the data is not perfect. It's never going to be perfect. We know that ICSs are working with that data. We're also working with it, unfortunately, ourselves. So we are trying to support ICSs as far as kind of year 3 plans, as far as trying to work out where they are in their current adoption rate based on their own data, the capacity tracker data and the PIR data, so that they know how far they need to go to get to 80%. So, you know, sorry, we can't change it.
Thanks, Karen. I mean, I think it is probably the first time, right, we tried to do a national data collection about the digital systems that people are using. So I think, you know, given the size of the sector, there's going to be some teething problems we'll all have to work through. So thanks for that. We have probably time for one last question. It may be a bit of a controversial one. Apologies for that. So for those ICS or ICB personnel on the call, would you recommend non-assured suppliers to the homes in your areas, in your regions, as there are new suppliers coming to the market with good functionality and pricing? So, head shake from Fiona there, which is fair enough.
Well, I suppose we're not in Nottinghamshire. I mean, I do make it kind of clear to providers there are other suppliers that are available, you know, not just the ones sort of on the list, but obviously impress upon them that those on the list have been through an assurance process. There's some comfort in that, and that obviously whilst I can offer them any amount of advice and guidance, putting them in touch with colleagues about, you know, connectivity or the data security and protection toolkit, I can only offer them, you know, support through funding if they go with the assured list. So I mean, there are definitely suppliers, there are definitely care providers in Nottinghamshire that have gone with digital social care record suppliers that aren't on the list. They are the exception in a way, but you know, they've found something that, you know, suits their organisation, and obviously that's the most sort of important bit. But so I can't say I really recommend it, but you know, do let people know that there are other options available to them if that's what they want to consider.
Brilliant, thank you. Yeah, I guess that is the important bit to remember, is the funding is only available for those solutions which are on the list, but also that the assured solutions list is specifically for digital social care record systems. So if you're looking for other types of technology, we mentioned a little bit some of the assistive tech and sort of sensor-based technologies. If you're thinking about EMR, rostering, then there are are the sort of ways to research that, and that's not linked to the Assured Solutions list. We are coming to the end of our time today, so I wanted to say a massive thank you to the panel for all of your time and your expertise. We will share contact details if you have any follow-up questions. Just have a final slide here as well, just as a reminder, there is funding available for year 3. So if you're a care organisation who hasn't yet contacted your ICS to find out if there's money, please do follow this link. Please do get in touch with them. It's always worth the question and a conversation, both about digital social care records specifically, but also about falls and sensor-based technologies. And I think that's the final slide for us. So thank you very much. I will share the recording, and I hope all of you have a lovely rest of your afternoon. Thank you.
Thanks.